Hello, everyone. My name is Christian Whitesell, and I will be talking about strategies for managing pregnancy-related low back pain. So, first, some background on low back pain. It's a major concern and issue for pregnant women, and it's very prevalent for many people today. It's often coupled with pelvic girdle pain, and women with low back pain oftentimes report significantly lower health-related quality of life compared to average healthy women. Low back pain is often defined as pain between the 12th rib and the gluteal fold, and although there are many similarities between low back pain and pelvic girdle pain, I'm just going to concentrate today on strategies for managing pregnancy-related low back pain, although treatment is oftentimes aimed at improving both of these. So after looking at several articles, there are numerous interventions for managing pregnancy-related low back pain. The first is called a belly bra, and this is actually seen in the image in the top right. It's a nylon undergarment worn like a vest across the thoracolumbar back, and it's designed to provide support as well as improve posture. As you can see in the image, there's a wide elastic band under the abdominals, and this aims to lift weight off of the pelvis and ultimately support the uterus. Furthermore, there are shoulder straps to help improve overall posture. Next, acupuncture. This was supported on a very strong level of evidence in a systematic review that highlighted numerous treatment options for treating low back pain for pregnant women. And when used during pregnancy, acupuncture is shown to reduce pain and increase function and the ability to work. One study states that acupuncture is as effective as a combination of stabilizing training, massage, and stretching for the regression of pain postpartum. Furthermore, and maybe a very important point, is there was no serious adverse events recorded for the fetus or for the woman during the acupuncture treatment. Lastly, an exercise program. So a lot of us probably think that this would be very appropriate, and the study that I read highlighted a 4-week exercise program focusing on stretching, tightening and loosening movements that specifically target large muscle groups from the neck to the vertebrae. And coincidentally, they also had counseling with nurses throughout these 4 weeks. And this counseling was very broad, and the structure kind of played out to discuss the pain, the methods of pain, the correct posture development, and body mechanics during activities of daily life, as well as the ergonomics explained to these pregnant women using illustrated booklets during the trainings. During the counseling, the nurse received information from the participants about their daily activities or daily life and did their best to educate the participants about the behaviors that might damage their low back and pelvic regions. The participants and the patients were given practical demonstrations on how to move and how to protect their low back and pelvic regions during activities of their daily life, such as reaching an object from the ground or reaching up to a shelf, and how to properly do this, as well as taking it as easy as they can on their body. Oops. So the evidence, there was a study that I also read. It was a cross-sectional study which included 295 participants dealing with lumbopelvic pain. 24 sought pain treatment out of the 295, so those are pretty staggering numbers. And these treatment options included mechanical treatment, which was the vast majority at 80%, herbal medicine, exercise with only 6%, and medications also at 6%. And another staggering statistic was the average perceived effectiveness of the treatments was 55%. So this is alarming to us as physical therapists and anybody in the healthcare field, that people need help for low back pain dealing with pregnancy. And the opportunity is there for one of these treatments to really show that it can be effective in helping these people out. So in the belly bra study, they used the Likert scale, and the 46 participants in the experimental group documented improvements in sleeping, getting up from a sitting position, sitting, walking, working, and overall impact of daily activities. And obviously there's some reliability with how often they wore it. They documented that they were wearing it all the time, but as we know, that may not be the case, but they still did document this. As previously stated, the acupuncture was supported by the strongest level of evidence in the systematic review. 7 different randomized control trials evaluated acupuncture and concluded that it is a sufficient intervention to target localized pain with women dealing with low back pain during pregnancy. And specifically, individualized exercise can immensely relieve low back pain in pregnant women while promoting their functional status. So that goes in part with that 4-week exercise program that was specifically individualized for all of the patients based on what they presented with and based on what they were capable to do. So the clinical implications. As you can see, there are several evidence-based methods aimed at improving low back pain during pregnancy. And it's very important for us as physical therapists to tailor our interventions at the individual's specific needs as well as their capabilities. And that may mean potentially trying more than one of these methods. If that's designing an exercise program that's specific towards them, then maybe when they're outside of the clinic wearing a belly bra, that could be appropriate. The exercises need to be guided and supervised to enhance performance and quality. This includes the type of exercise as well as the dosage and the delivery. You need to communicate this with the patient so you're all on the same page. It is important to address the patient's goals for therapy as well as their potential fears while exercising while pregnant. As we obviously can guess, there will be some. And lastly, there's more research needed on other techniques such as passive muscle relaxation, yoga, and water gymnastics, which seem appropriate, but like I said, need more research. My references are listed there. Thank you very much for listening.